RSV is a respiratory virus that's been around for a long time. In fact, RSV is one of the leading causes of hospitalization for young children under 5 years old. Now, how does RSV actually work? It infects the cells in the lining of our airways, causing these cells to die and clogging up the air passages with mucus and debris. That's why people with RSV can experience wheezing or difficulty in breathing. You might be wondering, if RSV is so common, why are we hearing about it more now? Well, a big reason is what scientists are calling the immunity gap. During the COVID-19 pandemic, we all took measures like wearing masks and avoiding large gatherings. That wasn't just effective against COVID, it also drastically reduced the spread of other viruses, including RSV. But here's the catch. Because fewer people were exposed to RSV over the last couple of years, populations missed out on the natural immunity they would normally develop. This immunity gap has particularly impacted babies and toddlers who weren't exposed to RSV early in life. Pregnant women, which means fewer protective antibodies passed to their newborns, and even older adults whose immunity naturally weakens over time. So, when public health restrictions eased, RSV came back with a vengeance. This isn't the RSV we used to know. This is different. This is urgent. The pandemic changed everything. Think of it like this. Our immune systems are like muscles. They need regular workouts to stay strong. The pandemic lockdowns acted like a period of prolonged inactivity, leaving our immunity muscles out of shape and ill-prepared to fight off RSV. A study published in The Lancet in 2023 showed a significant decrease in RSV antibodies in children born during the pandemic. Let's talk about the science behind RSV. It's a virus that comes in two main types, RSV-A and RSV-B. Scientists track these subtypes closely because they can influence how outbreaks unfold. They've also been studying the virus's seasonal patterns. RSV typically peaks in the fall and winter, but because of the pandemic's disruptions, we are seeing those timelines shift. The good news is that there's been a lot of progress in understanding RSV and developing tools to fight it. Let's get into some of the latest research and breakthroughs. This is where things get really exciting. Until recently, there wasn't a vaccine for RSV, but now we've got some game changers. First, there's a maternal vaccine called Abrysvo, developed by Pfizer. It's given during pregnancy, and it helps protect newborns by passing antibodies from the mother to the baby. For older adults, there's Arexvy by GSK. This vaccine reduces the risk of severe RSV infections in people over 60. Another breakthrough is a long-acting monoclonal antibody called Nirsevimab, also known as Beyfortus. This isn't a vaccine, it's an injection that provides infants with ready-made immunity to protect them during their first RSV season. On the treatment side, we still rely on supportive care for most cases. This includes keeping patients hydrated, using oxygen therapy, and in severe cases, mechanical ventilation. There's also an antiviral medication called ribavirin, though it's not commonly used due to cost and side effect. Excitingly, new antiviral drugs are being tested that could offer safer and more effective options in the near future. So, what does all this mean? Well, RSV is a virus we need to take seriously, especially for young kids and the elderly. The recent outbreaks were a reminder of how delicate our immune systems can be when normal exposure patterns are disrupted. But thanks to groundbreaking vaccines and treatments, we're in a much better position to fight RSV than we were even a few years ago. Scientists are continuing to monitor the virus closely. If you're a parent, caregiver, or someone in a high-risk group, it's worth talking to your doctor about these new vaccines and treatments. They could make a big difference during RSV season. If you found this episode helpful, share it with someone who might benefit. And consider to subscribe so you never miss an update on the latest health topics. Thanks for listening, and until next time, stay informed and take care.